Hi, this is Mary Helen Yarborough, reporting for our report. It's April the 2nd, and Maryland and D.C. and Wisconsin pick a GOP candidate tomorrow in their primaries. And later in the month, I think about 5 more states will get to participate in the primary selection process. And I don't know about all of you, but I think it's time we had another debate. I think that after, a month and a half or so with candidates telling each other they needed to get out of the race, and the presumptive leader, Romney, kind of stealing the light from everybody else, I don't think we've heard enough from the other candidates. Ron Paul, Rick Santorum, Newt Gingrich. We've heard a lot from Romney. It seems to be in a lot of sound bites. In light of the Supreme Court and their upcoming decision on whether to can Obama's health care reform law, I think maybe health care would be a good topic. And what I'd like to hear is what specifically these other candidates would offer. I happen to know that Newt Gingrich in 2009, through his Institute for Interactive Patient Care, developed what would have been a viable alternative or a health reform plan that would not be a government takeover, and it actually entailed working with grassroots or stakeholders in healthcare, clinicians, doctors, nurses, consultants, and as part of that, there's a thing called the Get Well Network. Now, that meets for the 5th annual convention in Orlando at the end of the month, and I imagine it's going to get a lot more attendance this year. I don't know why Mr. Gingrich never discussed his patient engagement health care reform idea when he had the opportunity. I thought it was a brilliant idea. I also happen to know that while a lot of doctors participated in developing this program, a lot of doctors felt like it put too much emphasis on doctors actually sitting down and explaining to patients what they must do to prevent going back to the doctor. And the doctors, and I imagine a lot of them, saw this as costing them money, because without sick patients, doctors don't make any money and pharmaceutical companies don't sell any drugs. I would urge everybody to look at this. It's really very interesting. And it is based on the premise of doctor engaging patients and telling patients what they must do to comply with their orders, how to stay well, so that patients actually understand what's wrong with them and what they must do to stay well. It made so much sense, and there are doctors and there are those that were involved in this that I believe are still actively engaged in the patient engagement interaction model. That's what Mr. Gingrich did. I'd like to hear what others. Now, Dr. Paul should have a lot to offer on this. Rick Santorum, I'd like to hear what he would do. We know what Governor Romney would do because he did it for his state. And to his credit, it was a state-based initiative. And it is different in that regard than the Obama plan. I'd love to hear another debate. There are a lot of specifics that I'd like to hear these candidates address, such as the pipeline, such as how we should deal with countries like Russia. My goodness, I think at this time these candidates have been on the road, they've talked to individuals, they've connected with people hopefully, and I think that they might debate a little differently now. That's my opinion, and for the meantime, for God's sake, embrace each other's ideas. Don't delete people's comments, and don't shut people down, and don't tell people to quit running for office. We still have freedoms in this country, the freedom of speech, expression, to disagree, to run for elective office. And I think it's a terrible trend, and I'm not going to go along with that personally, so I hope others don't as well. Thanks a lot. This is Mary Helen Yarborough reporting for CNN's iReport. Good night.